In this presentation, we will be highlighting the weight of social isolation and the importance of mental health awareness in older adults. My name is Sophie, and I will be introducing our topic to you all today. Social interaction is something that people of every age crave on a foundational level. Don't we all want to have witnesses to our lives? People to walk through all the seasons with and people to witness the moments that happen big and small? It turns out that social interaction is not only a desired pastime, but it's an essential component to our health and well-being, especially in older adults. We tend to see a circular effect when it comes to social isolation. As we have learned over the quarter, older adults can have a variety of different health challenges and restrictions. There is evidence that older adults with poor health are less likely to engage in socialization and vice versa. Studies also show that older adults experiencing social isolation are at an increased risk of developing health disorders like heart disease, cognitive decline, and depression based on the studies found in the National Institute of Aging. Personal health is not only an indicator of social engagement, social determinants also play a role in how we engage socially. Examples of these social determinants would be mental health status, socioeconomic factors like income or housing stability, environmental factors such as whether or not you live alone, living conditions and social engagement or lack thereof, as well as physical health factors. It is important to understand the ways that these factors impact one another in order to properly prevent ourselves from social isolation.
My name is Priscillah, and I'm going to be covering the primary preventions. As we all know, prevention is key. The early detection and prevention is very important. Just regular things like checking blood pressure, checking your cholesterol is very important. And it also helps with emotional and social health. So I'll be covering the primary preventions, and we need to reduce the contributing risks. With this will help the older adults stay socially active by encouraging frequent contact with family and friends through phone calls, video chats, and local senior activities to prevent loneliness. We also need to promote healthy daily habits, and that's like by supporting involvement in fun group activities like exercise, book clubs, faith gatherings to keep them active and engaged like with their minds. And then we also need to create a safe home environment. This will make homes safer by we need to make up the homes safer by adding like grab bars, improving the lighting and removing tripping hazards. This will help prevent falls and to make sure they don't get hurt when they live by themselves. Because when they get hurt, this will make them to stay home more, which might lead them to being isolated. And then we need to promote health maintenance and encourage them to do like early health checks. By this, we can encourage them to get their annual flu vaccines, regular mental health checks, and this way will protect their overall well-being and detect early signs of depression that may lead to isolation. Thank you.
My name is Hannah, and I'm going to be presenting secondary prevention. Depression screenings, anxiety screenings, cognitive changes screenings, and social isolation screenings are all very important, as well as sleep, nutrition, and activity reviews. There are depression screenings and anxiety screenings like the PHQ-9 questionnaire and the GAD-7 questionnaire. Oh, sorry, I'm not going. Okay, we can fix that. The frequency screening, you should have all of these screenings done typically annually, unless you are experiencing sudden changes like persistent sadness, fatigue, memory issues, agitation, if you're worrying more often, and you experience a decline in your cognitive ability. Warning signs to recognize would be mood and behavior changes, withdrawal, loss of interest or pleasure, sleep or appetite or energy changes, and cognitive and functioning changes. Self-monitoring techniques include a mood and activity diary. You can have a note of social contacts and activity, who you talk to and for how long. And you can also have a caregiver or volunteer check-ins with checklists for your family or volunteers performing weekly check-ins to record your mood, appetite, mobility, and safety concerns. And when to seek medical attention would be if you are experiencing active suicidal thoughts or intentions, and it is also important to complete the PHQ-9 depression questionnaire or the GAD-7 anxiety questionnaire, and if you score higher than a 10, you should reach out to your primary care provider as soon as possible.
Hi, my name is Nancy. I'll be talking about the tertiary preventions. So a few examples would be support groups. For those battling depression and PTSD, it's a place to bond, share tales, uplift each other. Another example would be ongoing therapy, cognitive behavioral therapy, for individuals recovering from depression, anxiety, and trauma. Family and community involvement, so social engagement activities, clubs, or senior centers. And lastly, education and coping skills, teaching stress management, mindfulness, and problem-solving skills to maintain stability.
Hi, my name is Lexi, and I will be presenting the case study for social isolation and mental health today. Jane Wong is an 85-year-old woman who recently suffered a fall. Prior to this, she was active in her church community, went to a low-intensity fitness class 3 times a week, and had an extensive social circle and support system. After she experienced the fall, her healthcare team is evaluating potential risk factors for social isolation and mental health challenges as a result of this. Jane has heard many of her friends talking about their tendency to become isolated and feel alone as they age. Jane begins to think about the value of her support system and being involved in social activities as she ages. Her husband passed away several years ago, and she relies on her family and friends to be her encouragement and company on the days when she feels alone. Now that she is less mobile, Jane will not be able to drive to her friends' houses or church events. There are 2 questions that we will be addressing relating to this case study. First, how could this fall negatively impact her social engagement and mental health? Secondly, how could social engagement positively impact her mental health during this difficult time? We'll look at the negative impacts of her fall on social engagement and mental health first. These negative impacts could be an increased risk of frailty and depression due to loneliness, an increased risk of social isolation, and decreased activity levels. The positive effects of social engagement on her mental health during this time will also be looked at. First is that she'll have community-based assistance from those around her. This leads into a lack of isolation and depression during this time, and instead it can be a time of joy and support for Mrs. Wong following her fall. Lastly, community can help distract her from physical pain. Next, we'll be going over Kitsap County community resources that someone like Mrs. Wong could call if she was dealing with mental health challenges. First is Kitsap Mental Health Services. They offer a full healthcare team complete with psychologists, therapists, nurses, and individual professionals to offer care to all people. They also have a 24/7 crisis phone number that anyone can call. They place a big emphasis on the opportunity to achieve full recovery from mental health struggles. Secondly, Adult Protective Services if living in a facility. Sometimes mental health struggles can be a byproduct of a larger issue, such as neglect or abuse within the home. This could also impact the nature of the social interactions that older adults are able to have. Adult Protective Services seeks to provide support and safety to older adults who may need resources in any of these areas. And they could be a valuable asset to someone who is dealing with mental health issues as a result of circumstances they cannot control. Next is the National Alliance on Mental Illness. They raise awareness about mental health needs, provide support, and educate those who are struggling with mental health issues. This is the largest grassroots mental health organization in the USA. And lastly, the North Kitsap Fish Line. Fish Line offers 2 on-site counselors with virtual mental health services also available to all people with low barriers to access. They seek to connect people in Kitsap County with the resources needed to thrive and offer widespread mental health resources to those in need.
So in conclusion, all 3 levels of prevention are necessary to ensure a healthy amount of social engagement. By assessing social engagement, screening for mental health status, and connecting older adults to community resources, we are not only supporting social engagement, but we are also preventing disease and promoting overall health. Here is our handout, which highlights the negative effects of isolation, the positive effects of social activity, and the potential risk factors.